Hi, Dr. Robin Sykes here at Jupiter Plastic Surgery Center. Thanks for joining us. Today we're going to talk a little bit about facelifts and fillers and how fillers can enhance a facelift or maybe be used in place of a facelift. And we're talking about one of my favorite products that I've been using for a number of years now called Radiesse. And basically this is a product that's not like the other fillers. It's more of a collagen base. It helps to build collagen and elastin. Actually, it causes your body to build around it, so it actually has a longer lasting results. And actually my favorite product for using around the cheekbone area, which is, I have to say, this is our rep here, he says that's an off-label area, so I have to mention that. It is actually on label, you know, for a number of things, and they're all the time. The companies have to go back to the FDA and get things approved so they can talk about them. That's one of the reasons. You can't really talk about these things. That's why I'm talking about them instead. And I just wanted, this is one of the original things. All the fillers were used, their initial area that was approved were nasolabial folds. Obviously it works well there, just like other fillers work very well in that area. So there's some really great photos here of before and afters of the nasolabial area. This is an area, though, if you ever heard me talk before, I said it's really not so much aging. Many people have these lines when they're born. So eradicating them is not always the best policy. But everyone's different. We analyze everybody to see what's going to be the best results. But that is, great if you can make that area look a little softer. All these have been doing that. So, so when we're doing a facelift, what I'm trying to do basically is to create a nice, useful look like this.
John.
So basically, I'm trying to make a better neckline, better jawline, minimal scars if possible. I usually do a mini lift. Where the scars would be basically on a man. You can turn your face a little that way for me.
Mm-hmm.
Underneath the sideburn area here, so the hair's going to grow over, and then usually kind of straight here in front of the ear, and then up behind the ear, so you don't see that incision. And then under the neck, if we need to make your neck look smoother. So if you have a deficiency of the jawline, that's one of the things that's now been approved by Radiesse.
Correct.
Makers of Radiesse is being able to improve the jawline. And just to so you can get an idea of what that means, this is a great picture here of basically a little laxity of the jawline. He's not had surgery, but some filler has been placed along the back of the jawline area to make that area look stronger and that line smoother. So that's a really good use of it. And also, this picture here shows you jawline and chin, because chin's part of the jawline. That's where its new approval has been for the Radiesse. So why I think the Radiesse is good, along the bone structures, because it has this better ability to kind of withstand all the muscle action and things in the face. It forms a nice, smooth, really natural look. So I happen to really love it for that reason. So many times I will do filler at the time of facelift if needed. It might be Radiesse, it might be fat actually. But generally the cheekbones is one of the two. Those are my favorites. The advantage of fat, of course, being it's your own tissue. It potentially will live for a much longer time and stay there versus a filler, which goes away in maybe a year, 6 months to a year. Usually the upper end, I think, in most of my patients I find that. The mini lift, just to digress a little bit and tell you a little more about the mini lift if you don't know, that's kind of my favorite facelift. I love doing them. They have scars that usually hide really well. Gives you a nice natural look. It doesn't give you too tight of a look. It's a relatively shorter procedure, so it's easier for your body to take and to heal from. Less risky to your nerves because it's not as much undermining. And I just think it's a really good procedure. And it's also really good for younger people that don't need a lot, and good for older people that really can't do a lot, that just want to do sort of a less invasive procedure. And then all along the line, it comes in very handy with many age groups. So it is kind of my favorite. And the best part is minimal scarring. You don't have that big long scar that goes along the hairline, which you can't really pull your hair back without seeing it. And people that have that, and anywhere out there in the audience, you may have seen this before. And I think it's nice to try to avoid that if possible. So, talk a little bit more about Radiesse.
It's great. It's the only filler that gives you the immediate lift, and then it actually stimulates the body's natural process of building type 1 collagen, type 3 collagen, and elastin after the filler is put in over a 6 to 12 month period.
Right.
So even in older folks or younger folks who may be lacking the collagen build, it enhances that effect as just giving you the volume.
Mm-hmm. Right. So volume is where it's at, honestly. You know, when people come to see me, and sometimes they've lost weight, they've gotten older. I have patients that I've been seeing for many years, and you know, what's changed? Well, I lost some weight. You know, I've seen that a number of times recently. And well, gained weight too over COVID, but the weight loss, you know, it shows up in your face, you know, on top of the aging. So putting some volume back in the cheeks is one of my favorite things to do, I swear. It's just such a nice, rejuvenating look, and it doesn't look like something drastic happened, but you just look really good. So
it's actually been a major factor with the takeoff of Ozempic and semaglutide.
Mm-hmm.
Usually post.
Very good point.
Yeah,
very
post
good point.
Those, you know, using those peptides, Radiesse.
Especially to lose weight fast. You know, that's
exactly.
the thing, because with those products, people are losing weight a little more quickly, and then they see that draining. You know, and it doesn't really. You put the weight back on, it doesn't come back the same place. I want to talk about the Radiesse of the hands. That is one of the approved areas as well. And we've had a lot of success with Radiesse of the hands. I've actually got a new procedure going with the skin of the hands. So now I compare that with the Radiesse. Basically, it's an erbium laser treatment that's going to help. It's a series of 3, and it's going to help the pigmentation of the skin. And then coupled with that, again, volume. Cause it make your hands look younger. The top is pre, and the bottom is post. I think it's probably several weeks later. Does it say? 3 weeks later. So basically, you get some nice fullness. It doesn't take a lot of product to do that. We're basically putting a little bit of product in the kind of a space between the veins and the skin, so it helps disguise the veins. It gives you a little extra fullness, and it makes your hands look, you know, younger to match the face we were trying to work on, which is a nice thing.
Feedback I've received is that while people are driving, they can't get their eyes off their hands now because they love their hands so much.
I like that. I like that. Oh, I didn't know this picture was on here. This is great. Here's a good use for Radiesse. This off-label earlobes. You can put fillers in the earlobes, and there are people that need that. People that a lot of people's earlobes get really thin as they're getting older, and their earlobes, they don't look good with the earrings. The earrings kind of hang wrong. It's kind of a neat thing. Now, one more hands. So I have a lot of hand pictures. Okay, good. So do we have any questions at all?
Actually, I do. My first question is, how long does Radiesse last?
So that really depends. I mean, as I mentioned briefly, I think there's more like 3/4 of a year to a year. It really depends kind of on how much you put in, honestly. If you put a little tiny bit in, if you're just doing a little bit of lines, it's probably not going to last quite as long. But I find it pretty long lasting. I really like it. Like I said, in the cheap ones, I think it lasts at least that long.
What's great also, as opposed to like alternative HAs, is that because it's a biostimulating filler, it's giving you that type 1 and type 3 collagen and that elastin that is lasting further than just the period of the volume that you're seeing. So you're getting that natural process and rejuvenation in the skin because it's a biostimulating filler.
Mm-hmm. Very good. Thank you for that. Okay, so good. What else can we answer about that? Oh, if anyone's listening today, you're going to get $100 off on a Radiesse injection. And let me talk about the other product that you sell, that we use, which is called Xeomin. You've heard of Botox, and you've heard of Dysport. This is just an additional product. I like this. I made him give me this. I love this. This is a model of a molecule. And this molecule is Botox, right?
So yes, it basically explains the immunogenicity of toxins, and basically the larger the molecule is, the larger immune response your body has on it, which in turn can create resistance over time. So,
which is what we've been seeing now. We've been doing long enough, I think, with the neurotoxins that you're starting to see people that are getting a little more resistant to them.
Absolutely, and people will go to Xeomin specifically
because
to
of that.
become less resistant. The reason for that is that Xeomin is strictly just the active ingredient in botulinum toxin type A's. And
so these, you got 3 different colors. They're brown, yellow, and blue. And the brown is this full one, and with Botox. If you take the brown off and just have those 2, that would be Dysport. And if you take them both off,
strictly 100% pure, just the active ingredient.
So that's the beauty of Xeomin. So we do have all three here, and I use them for various reasons, and we'll discuss those at the time. But it's good to know they have the Xeomin because people that start developing resistance, that might be the product that we use to kind of get them through that period, because you can actually use it to see if they're getting a response again. Because over time, if you have an antibody response, potentially it'll diminish over time.
Correct.
So if you use a little Xeomin in the middle, you can see, oh, they're starting to respond again, without causing more of a reaction.
Exactly, and that's why we see it, especially with the millennials, Gen Zs, and Gen Xs, focusing on Xeomin the most, because the earlier you're using it, we're seeing people use toxins earlier and earlier and earlier, early ages, that if you use that with the less of an immune response, you're way less of a chance of becoming resistant. If you plan on taking your aesthetic life from, say, as early as 22, 25 years old, all the way into your 60s.
You have a much better chance of developing a problem with it, yeah. I've mentioned that to people as well.
So that's why it's the fastest growing currently.
So you have to think about that, think about yourself in the future.
Exactly.
Because you'd be like me eventually. All right, very good. So anything else, Sue, that we have to comment on?
Yes, I have a question here on the mini facelift that you were talking about, the incisions for a man.
Yes.
Molly is asking if the incisions for a woman are in the same location.
Thank you very much. That's a good question. So I meant to point out the man because I don't often have a man to talk about. With the women, though, the incision goes along the edge of the ear tragus portion right here, so it's really pretty much invisible. With men, it's in front of that, and so you potentially can see it more, but you don't want to have beard up on your ear, so that's why we do that. So with women, it's pretty hard to find. You have to look pretty hard to find that, and again, behind the ear in the crease, and then down here. For most people, I'll use incision down below as well. Audience, we have a live audience today.
What's the recovery time
Recovery
on
for-
your mini facelift?
Okay, good question. So if I'm doing eyelids at the same time, then the eyelids stitches come out about 3 to 5 days. If I'm doing a facelift, it's 5 to 7 days. We'll take the stitches out, and so then they're basically all, yeah.
What's the recovery time on using Xeomin or Radius?
Radius, the filler, usually I tell people 3 to 4 days, maybe at the max, you'll have some swelling, and that will go down. And generally, actually, sometimes when I'm putting it in, I do a lot of little pokes, and you get little swellings and things. And sometimes people go, "What is that? What is that?" And by the next day, it all pretty much settles down. And within 3 days or so, it's just beautiful. I've just see beautiful results with that filler. And then your other question about facelifts, let's finish that. So you take your stitches out, but you have bruising potentially. Not too bad with the mini lift. It doesn't hurt a lot. Bruising is primarily kind of in the neck because we're really not doing much in this part of the face. So you can actually wear hair down, cover a lot of your incisions, maybe put some makeup on your neck, and actually function pretty well at a week to 10 days. It's pretty quick. And post-op pain is, I have to say, minimal for most people. I have had people over the years that had more pain than others. Everyone's different. I mean, everyone is different. Generally, I'll just write for mild pain relievers. It'll be taken for a day or two. I might write for a stronger one for the first day because that's the worst day, and then I get better after that. And then a lot of people will switch off to extra strength Tylenol, which is very effective, by the way, post-op facial pain. It's not like knee pain, and those pains are worse. Face pain is not that bad. Did I answer your question?
You did, but is there any recovery time for Xeomin?
Xeomin. No, you might get little poke marks. Now, how long does it take to last? That's the next question.
Okay.
Does it take to work? Most of these neurotoxins, it's going to take on the order of a few days to start seeing something. I think Dysport and Xeomin may be a little quicker. It can be a little slower, up to a week to start, and then usually by about 2 weeks you're pretty much done with it. You're kind of showing the full effect. And then it should last, they're 2 to 4 months. That's what the common parlance is. Generally, people come in at 3 to 4 months and get put back in. There's another newer product out too that's supposed to be longer lasting, and I don't actually have it yet, but it's supposed to last a bit longer.
Want to tell us about it so we can anticipate?
Well, it's very similar. It's just, potentially a little longer lasting. I mean, I've heard various things. It doesn't last quite as long as it should, or, I've had people that do neurotoxins that we have here that say they last 6 months. Everyone's different, Then there are people that last 2 months. That's uncommon, but it can happen.
Strength of their muscle, how the body metabolizes it,
Yeah,
how long they've been using toxins.
And men too.
A lot varies.
Men have bigger faces and stronger muscles and may require more. So I may have to give them more just to get through that. Or women have really strong facial muscles and they may require a little more. But again, it's very individual. Generally, it's reproducible within the same person over time. I'll know if it's going to work similar the next time. So. All right, very good. Well, I think that's all I wanted to say. Oh, I forget my little list here. June newsletter. Don't forget to sign up for your newsletters, and then you can find out what the specials are. The product of the month this month is called Techno Neck Firming Cream. It's a very nice moisturizing cream for the neck. It's made specifically for the neck, and that's by the company Skin Better Science. And that's $25 off. Good deal. And then you can get a complimentary full-size eye cream if you do eyelid surgery, if you actually sign up as a response to this particular event. And then our Mary's, our esthetician special, is microneedling treatment of the face and neck for a savings of $150. It's very nice. You can do the one for a good price. Most of the time it's series of 3 with microneedling, if you know that. And actually not next week, but the 28th, we're having another seminar. We're talking about facial shaping a little more, non-surgical rejuvenation, microneedling, Pellevé, and fillers. And we're going to talk about our latest peel we're doing now is an erbium peel with a couple special products added afterwards to make a better result. That's upcoming. That's going to be great. I did that. That's what I did on my hands I was talking about. It's an erbium laser. It doesn't hurt. I did it with no topical at all, plus a couple of products added to it. I've done it one time, and I can see a difference already in my hands. So I'm going to do 2 more of those. So I'm going to have a good before and after just to show you. And then, but it's good for lightening. It's very easy to tolerate. You have very little downtime with that. Erbium laser is a super, super light laser which takes off a very, very top layer of your skin. And then when you do that, we're applying these products to penetrate a little deeper. So it's a nice concept. It's kind of like the microneedling, but it's with a laser. So, and then in July, we're having another Lunch and Learn with our SEO rep, which I know a lot of people are excited about having that coming up soon. And let's see, what else? What else do I forget?
I think you have covered everything.
Okay,
Yeah,
great.
yeah.
So, I was going to say one more special: $100 off the Radius, or $50 off the Xeomin treatment in response to this thing today. So, give us a call if you're listening, so we can kind of give you that special. And
We might want to mention too, we do have one more special going on, our Emsculpt Neo.
thank you, Sue.
So we have the 4 treatments for the price of 3, which is fabulous.
Yeah,
this summer.
please don't forget about that. That is an awesome. You're not going to hear this special anywhere else. Emsculpt Neo. Basically, 4 treatments for the price of 3. Emsculpt Neo is that great electromagnetic stimulation of the muscles of the stomach, which is going to also reduce the fat in that area, tighten up the muscles, give you a stronger abdominal core. And it's a half an hour session 4 times, which each half hour is 20,000 sit-up equivalent. It's fantastic. You've done it, right?
I have. I've tried
Yeah. How'd that feel?
it felt good.
You can feel it. You can feel what it's doing. It's
It's
pretty
like the
cool.
gym.
Yeah.
There you go.
Like
right?
the gym on steroids. So, and we do it here in the office.
Without being on steroids.
Pretty easy. You don't have to. It's pretty much no downtime. You feel great, and you get all that great reduction in fat up to 30%, and increase the muscle fibers. It's awesome, and you can use it in other parts of the body too. But special's going on now. You have to call and ask for how to get that deal from Sue. She'll give you all the details.
Plus, we also have Sarah coming in on June 30th. If anybody wants to come in for a demo in the morning, she'll be here.
June 30th is the day to
Friday
come in and
morning.
get a demo.
Yeah.
We can give you a demo other days too, but that
Of course.
day you can get a super demo from Sarah. So she's our rep. Thank you so much for being here.
Absolutely.
I do appreciate
Thank
your comments, and I hope that you all got something out of the seminar, and that you'll come in and ask us about these fillers and the facelift at some point. Thank you so much for our audience. Nice to have an audience again.
Yes.
And we'll talk to you again soon. Thank you.